You're watching MIA, where we go behind the brand to see how successful women manage it all with actionable tips and tricks you can use to create the brand you want and the balance you crave. So today on MIA, we're going to be speaking with Dr. Annie Purcell, and she is the owner of Redding Spine and Sports Medicine. All right, so Annie, tell us a little bit about what you do at Redding Spine and Sports. What's your official title as a physician?
I own this practice with my husband. We're both physiatrists, and the specialty is called physical medicine and rehabilitation, or some people don't know what that means. So we do a lot of sports medicine and spine care, non-surgical treatment options.
Oh, really?
Yeah, and we've had this practice for about 4.5 years. And so we're both the joint owners, and we're both full-time physicians. And then I also oversee a lot of the administrative side of the practice.
Wow. So a lot of work for you and your husband, and you have 2 children, and Gio is now,
he's going to be 4 in June.
4 in June, and now you have Giacomo, which I love that name.
Thank you.
I know it's going to confuse a lot of people. And you call him Jocko. Right?
His nickname's Jocko.
I think that's so cute.
He just turned 1.
Okay, so when you had Gio. What did your life look like before you had Gio? Had you started your practice at that time?
Yeah, it was actually right when we were opening it. I was already pregnant, and it just was early, right? So people didn't even know, and so it was kind of nice because when he was born, we were still in that phase of building the practice, so it wasn't as crazy. But our life before we had kids, we thought was so busy because we were med students, we were residents on call, we did a fellowship, and after we had kids we realized that we were kind of chilling out because we used to go to the movies and we used to go on trips and we used to go out to dinner all the time, so those things were fun.
And you forget to make time for those, right, when you don't have kids, because you think you're so busy at the time that you have all this time that you're going to be able to go out and see a movie later. And
now we thought we were super busy, but now we know we were just having a good time.
Now you guys, when you guys were running the practice, I think I remember Gio used to wake up at like 5 a.m. or something, and you'd start your day then, right? And
he just started sleeping till 6, very recently, like after age 3.
Well, now you're in the habit, so it's okay now.
Yeah, so it's crazy how things evolve. I thought that was so exhausting, because he would be up at 5 every day, and if he woke up, and he was a bad sleeper, so if he woke up in the night, my husband would cover that, and then, once it hits 5, I'm on the clock.
But then you had to get up and work the next day.
Yeah, we always had to work. So the first year of his was rough, sleep exhaustion-wise, but the thing I realize now that I don't get into work until like 5 minutes before my patient's on the table is, I used to get up at 5 with him, spend an hour and a half with him. I would drop him off at the daycare at 6:30, and then I'd come in and do all my administrative work for the office from 6:30 to 8. So now with the 2 kids getting ready and just getting them barely there on time, I'm thinking, why am I so behind on everything else? And that's kind of the reason.
Yeah, absolutely. I mean, how do you even make time for working out and all that stuff for yourself?
Yeah, so that's that's a big negotiation between my husband and I, because we both want to exercise. There's really not a lot of time space there, so we found that it has to be something that is scheduled in advance or it'll never happen.
Yeah.
So I just negotiated for me to do a boot camp coming up. I've been wanting to do one for a year, but the kids' sleep is finally almost to the point where I could exercise and be done before they wake up.
Yeah.
So that's a new window of opportunity.
That's nice, and that's where women have to get our time in, right?
Yeah, I like that time.
It is, yes. I'm so with you. 5 a.m. is a little early for me, but
I'm good with it.
Yeah, you are good with it. You've been in boot camp. So tell me what it's like kind of running a private practice. What is that for other women who are in med school or in residency and want to get out there and start? What is that like?
That's an interesting topic right now because when we thought about doing this 5 years ago, it was a much more favorable thing to do. And so I don't know that with all the changes in healthcare, it might not be someone's first preference, or it's not such the sure thing that it used to be. If you knew you're a good doctor, you just open up the doors and everything will be fine. Don't worry about it. That's changing a lot. But with that being said, our practice is still doing very well, and we still feel like this is the best option for us right now. And even though the predictions are the small private practice, will die, and will eventually everyone will work for these big hospital groups. Wow. That's not in our immediate plans. We see that we're going to be rolling with the changes, and this is really still working well for us. So I guess my advice would be, don't completely rule it out, but know that things will always keep getting harder as far as it looks right now.
That's great advice. I mean, I think that's very realistic.
Yeah.
For the climate right now. And do you feel like you have more freedom or less freedom since you did open your own practice?
Yeah, I think overall we still feel like we have more freedom. You have to step back and try to remind ourselves what that is. But for us, in the end of the day, we can still always decide when our own hours are, decide when our vacations are going to be, or if I want to help out with my kids at their school, I don't need to ask anyone for that. Looking ahead to all that stuff. That's still really important to us. And then the other thing that it's part of the reason why we wanted to open our own practice in the first place, freedom-wise, is we didn't want to have to work for someone else who was going to tell us how we had to practice medicine based on money. So that was the number one reason. Neither of us really intended to go into opening our own business, but we've, speaking to colleagues and friends, you're working for this group, they want you to do this many procedures, they want you to see patients in this amount of time, and we felt that would take away of our enjoyment of what we do. So that's why we care
too. Like, I mean, you guys have
you just don't feel right, and so when that's not your business, well, they don't care how you feel. These are the numbers, and so we thought we'd rather, if our salary goes down because we're still doing things the way we want to do them, we're still doing great. We want to be happy.
Yeah,
so but in the end, we still think that, and that probably will slowly whittle away with the pressure of having to practice. That's true. Right now, we still feel like that's the right thing for us.
And your heart's in the right place. I mean, I do remember when I had to come in for my, I had a knee issue and I had to go in, and turns out I had bursitis, but I did call Annie and she said, come on in and let me look at it, and she pulls out this big machine, the ultrasound machine, and looks at me, and within I don't know, what was that, 10 or 15 minutes, she's like, yeah, you've got bursitis. And you shouldn't be complaining that much.
You just wanted to know if you were going to live or not. I assured you. Yeah. And you sprinted through the half marathon.
No, we had a blast. But I'm saying, I think the way you approach patient care is really amazing. And I can see that in not only your practice, but also with how you treat your kids. And I think that probably the big $1 million question would be, how is having a practice or any business with your husband?
Yeah, people ask me that every day, the patients, because they're like, oh, your husband's going to be doing my EMG test? So we aren't the type of couple that wants to be in each other's face all day at all. And I tell people, there's days where we get home and I might have seen him once at lunch for 5 minutes, but we both have our own schedules of patients and our own medical assistant, and we're very busy, so the amount of time we probably even talk at work is max 10 to 15 minutes. Wow. Because, it's nice to have someone there that has your same interests, that you trust, and is a great physician, so that you have that partnership. But other than, every once in a while there's a patient that he or I both, well, let me run this by you. It's not sure.
I think that's nice.
That's nice, but other than that, we are not just collaborating side by side all day. So in general, we get along pretty well.
Well, I think that's great. And Joe's super laid back. So
but there's a lot of days where we both go out and do procedures at other facilities. So we're not even both there at the same time. But the plan wasn't to be rubbing shoulders together all day.
So what would you say is kind of your biggest, if you could talk to yourself about managing it all if you could look into your life in the future and know that you were going to have 2 beautiful boys and have this life, you're practicing in your own practice, what would you say to yourself?
I think to give myself advice for back then, I didn't look at the big picture early enough, and I didn't have sort of the confidence in myself to change things soon enough. So some of the things were delegating more, not feeling like I had to do everything myself, even though probably other people felt that I should, right? Like I've had like a couple epiphanies where at one point, you know, Giovanni was just a baby, the practice was very busy, I was back on full-time patient care, and I was folding laundry on Sunday, folding laundry on the couch, and I looked at Joe and I said, I do laundry all day Sunday. You know, I work 40 to 50 hours a week. We don't have time to do anything. Like, why am I standing here all day on one of my 2 days off doing 6 loads of laundry, you know? And so it was easy to reevaluate where I'm spending my time, have someone help me with something like that, so we can go do something with our kids that day or that. And then the other thing was, for a long time, I would see patients about 3.5 days a week, because I needed time to like do the grocery shopping and run the errands, and I was doing all that stuff.
Yeah, you were managing it all,
right? But I went to lunch with a doctor friend of mine in the Bay Area who's very, you know, he's the CEO of a huge organization, and those crazy people who usually work 120 hours a week, and then at Christmas he works 80, you know. But anyways, he's talking to me about how the practice is going, what I do, and I said what I just kind of told you, what I was doing with the 3.5 days a week, and he said, well, do you want to only see patients 3.5 days a week? Are you attached to doing those things yourself? And I thought, no, I'd much rather be in my business than doing all these little errands and you know, the stuff that was overwhelming me. So he
and probably
so why
you have no interest
so why are you doing that yourself? And it was like that. I went home, I put out an ad for a personal assistant, got tons of applications, interviewed 10 people, found a perfect person, and that's been working with me now since August, and totally changed everything. I see patients full time, I have time on the weekends for my kids. So why did I keep doing that for a couple of years before I went, you know, you need to sit down and look at where you're spending your time, and is that the best thing for you and your long-term goals?
I love it.
You know, I don't think my kids care if someone else went to the grocery store.
No, they don't. Trust me, they don't. They don't even realize we go to the grocery store.
Exactly. So I don't know what I was, you know, I should have looked at things like that sooner.
Do you feel like any of that, because I know a lot of moms feel like guilty if you put anything out to someone else, like if you delegate something out to someone else. Did you ever feel any sense of guilt?
Well, I don't feel guilty, and that's one of the things I thought when I was hiring the personal assistant position is, this position is not for you to come help me with my kids. This position is for you to do the other things that gives me more time with my kids. And so I don't feel guilty about that.
I think that's a great way to say it. I think that is just an outstanding way to look at things, because we all, at least I know for myself and everyone I know, like, feel a little guilty sometimes when you have to get a babysitter to do something else, or you have to get a babysitter to, you know, anything.
We do. We still feel guilty when we have to get a babysitter for something, because our kids go to daycare in the first place. So we really try not to do that as much as we can. But the other things like that, I think it's a no-brainer, even though other people, you know, might have different ideas about it. The guilt thing is hard. It is. I think my husband and I feel that if we can look at what we're doing and that is what we both feel like is the best for our family, we have to try not to listen to what other people think, because I'm sure you've had this too. Oh, the daycare, oh my gosh.
Yes, oh yes.
Like it, you know, like it's the worst thing on earth. And I want to ask that person, like, do you think I should, you know, but I don't go there because everyone has their own ideas. I just try to laugh, and, you know, that's what works really well for our family.
And if you're happy with where you are, then I think that's the most important thing. Now, if I've obviously been dropping my kids off somewhere that I don't feel comfortable, then I may feel a little bad about what you're saying. But I always think, you know what, you're not in my life, and it's something that you can't even speak to. You know, so, you know, naysayers, you can't listen to them.
I mean, the stay-at-home mom versus working mom debate is such a hot topic and very touchy for people.
Absolutely.
And I think that it shouldn't be such a debate. It should be, everyone needs to do what they feel works for them.
Exactly. To each his own. No one doing something is better than the other. It's just, it's what works for your life, and there shouldn't be any judgment. And that's kind of the hope.
But there is a lot.
There is. But that's the hope with this, like with this series, is just to show that, hey, there are women out there, this is how they're doing it. And this is why. Like it probably makes you a lot, it makes me so much happier to be working
Me too.
than to, like I would die if I had to stay home.
That's like sort of an innate thing that women don't know which side they fall on until they actually are
have
there.
your kids, exactly.
There'll be women that I went to med school with that worked so hard to become a physician, and then the minute they had that baby, they just knew, I don't want to go back and do that. I want to be here, and then that's okay. That's what you should do.
That's right.
You know?
That's right.
But it's just which one you are.
That's right. Exactly. Yeah. I love that you said that. So Annie, another question I wanted to ask you is, when is it ever a right time for a physician, or really any woman, to have a child?
Yeah.
I think in your position as a physician, it's a little different because
it is.
You know,
there's never a time that seems like it would really work.
Yeah.
So, but looking back, I think the way we did it worked well because we were sort of under our own control by the time. And I would say I had colleagues who had a baby during medical school and residency, and those times do seem like it would have been a lot more difficult because of being on call and just not having a lot of flexibility. I don't see how we could have had a baby with both being on call residents.
I was going to say with
New York City apartment with no family, right with us there. So I think that when you're in your training and being on call, you can do it because anytime you can have a baby, in how difficult that can be sometimes. You should, but if you're trying to plan and when to wait, I would say, definitely try to get through your residency. It would be huge.
Yeah, because residency is so demanding. I mean, people don't realize, and I only know from being, married to a physician as well, is like, people don't realize, I mean, residency, you barely see that person.
Right.
I mean, if you can have a baby in residency, that's pretty good, especially with two physicians.
Imagine if you had a baby and you just went to work for like 35 hours
straight. Yeah.
And you're in the pumping, and I mean, it's just, that would be, if you're working like a regular schedule, at least that's more doable.
And how do you feel about women, one of the things I see that's the hard part with women residents or women physicians is that you do have to put off, that maternal instinct until after you're done. And that can be 8 to 10 years worth of, wait time.
For me, that was nice because I thought let's wait as long as we can.
Yeah.
But I think if that's really important to you to have kids at a young age, I've seen some women do it where they take maybe a break in their training for a year, or it's still an option.
Right.
Yeah.
I love that you said that. It's still an option. It's still an option for everyone.
Don't feel like if you want to be a doctor, you can't have kids for 12 years. People do it, but the best time might be when you're not, always on call.
I love that. So Annie, tell us what's next. And I want to hear kind of what do you have in the plans and the works next, vacations, expanding practices, what do you have going on?
I think our practice is very busy, and I think we will have to bring on additional providers to help us meet our needs. But our immediate plans are that we want to keep rolling with the punches of the healthcare system and try to keep our practice to be successful and make it work for us as long as we can, and whether that's forever or not, we'll just go year by year, look at things as they come, and hopefully get to go on vacation this summer. We so far have always taken our vacation,
In the summer?
We take one in the summer, one in the winter, and that's a priority to us.
Absolutely.
We'll work really hard. We'll do some Saturday before and after if we need to make it work, but we always take our vacation.
I think that's fantastic.
Yeah, that's totally important.
Yeah, absolutely it is. So, Annie, where can someone find out about you? If they want to find out more about your business, who you are, where can they find out?
We do have a website for our practice, reddingspineandsports.com, just really straight out, and it tells a little bit about us and what we do. And a lot of our business is from referrals, so usually if people are interested in seeing us, they'll ask their primary care doctor or maybe a surgeon or specialist. We'll refer them to us, but we also take a self-referral patient as well.
Wow. Well, thank you so much, Annie.
Thank you.
I really had a good time.
Great topic.
Well, you were a great interview, so thanks so much.
Yeah, thanks a lot.